what we observed during this process is we had lots of young patients. And young patient plus breast cancer a lot of times means BRCA mutations. So this is a DNA repair gene. So if it's defective, your body is under constant attack, your DNA. You have to keep repairing it. If you don't repair it, it will result in severe mutations, which will become cancers. So 1 in 1,000 women is BRCA mutation positive. And about 2.5 to 3% of Ashkenazi Jewish have this mutation. So it's a tremendously common mutation in our area too. So what we found that those who had BRCA mutations actually produced fewer number of eggs in response to ovarian stimulation, 7.4 versus 11.3 that were BRCA mutation negative. And if you look at those who only produce few eggs, less than 4 eggs, which we call low responder, BRCA carriers, especially BRCA1, were 40 times more likely to be poor responders. So we discovered sort of a new part of the syndrome. And interestingly, we've been studying this in the laboratory as well. I'm going to get to that, but we have now BRCA mutant mice, and when we stimulate them, they also produce fewer oocytes. They have fewer number of pops, and they have, when we count their eggs and their ovaries, they have fewer number of these eggs. So this seems to be a real phenomenon. My colleagues at UCSF looked at the menopausal age in BRCA carriers, BRCA1, BRCA2, and they compared them to women in SWAN study, looking at menopausal age from SWAN study. And these women go to menopause about 3 years earlier. So something is happening in BRCA ovaries. Between you and I, we know what's happening there, but that's a topic for another talk, and it's also another paper in the process. But we deal with a large number of patients in this situation. And recently, we said, well, let's measure their anti-Mullerian hormone levels. I told you that's the best marker we have. And here are the patients who are BRCA negative, their levels, BRCA1 negative, and non-BRCA1, those are BRCA2. And BRCA1 patients have significantly lower ovarian reserve by AMH, and this is exactly what we see in mouse models as well. So there's clearly something going on here, and to be continued.